Sir, we need to be cautious about this. It's not healthy for a man to double his weight within a day. Triple.
Eating hamburgers or fast food, we do know is not good for you. There have been documentaries on this. You know, you've seen these shows where people just eat fast food, and yes, they're so calorically dense that there's so much calories to them that you'll overeat your daily expenditure pretty fast. Oh, what the heck is that? Missing nuclear inspectors. So if you hang for a very long time, you actually cause significant amount of injuries to the structures of the shoulder and the axilla. Your brachial plexus, all the nerves to your arm, go through your armpit, as well as the vessels. So you stretch those out, you cause neuropraxia, injury to those nerves.
My heart! This could be my last moment on Earth.
Chest pain after eating. Obviously, the thing we always worry about is a cardiovascular event. Are you having a heart attack? Are you having angina, which is just a medical term for chest pain? Are you having unstable angina? There's a lot of things that overlap in the chest. We check all of these major things when somebody comes to the emergency department. Our job is to rule out the scariest things. Not all the time can we actually figure out what's going on. If we have a high suspicion for cardiac reasons, then we potentially will actually admit somebody to the hospital.
Smithers, this means that no one will mourn me when I'm gone. My only legacy will be the extra radiation in every drop of water on Earth.
Oh my gosh, nice. Okay, so now he's got tears that are radioactive. Not sure if this is actually a real thing, but I will say that in the hospital, say we have people who deal with x-rays and radiation a lot, CT techs and x-ray techs, they actually carry a monitor on them to make sure that they don't get too high of exposure to radiation. If they start to get that way, they need to step away from it.
Don't give up, sir.
No, I give up.
Don't give up. Don't give up. Don't give up.
I give up.
Don't give up.
Seriously, I give up.
He's not on anything that requires him to be connected. Sadly, his assistant moved the bed a little bit so he couldn't reach it. That's actually a normal technique that we use. Sometimes we'll have people who are very confused trying to get out of bed. We actually do the opposite, where we lift the head of the bed up a little bit, but we also lift the legs up, and it's very difficult to get out of that position. You can still move around, but it's a very safe way to just try to keep an individual in the bed.
I told you, Bernie, to guard the bee.
But why?
Oh, you guys are pathetic. No wonder Smithers made me head bee guy.
Bees are fantastic for us. They help with making honey for us. You get it locally. It's actually quite good for your system because they're using the plants and the flowers that are around where you live, and that's actually very good for you. And pollination, and very good for the environment. But people can potentially be allergic to bee stings. Oh no.
It's cutting away. No! The bee bit my bottom! No, my bottom's big!
Okay, so I don't know the context of the bee, but if you're allergic to bee stings, you know you carry an EpiPen around. People will come into the emergency department, status post a bee sting, and have a huge range of symptoms, from just like a welt to swelling to full body swelling to hypotension. Very scary. If you have an allergy to bee sting and you actually get one, get to the hospital ASAP because things can move quickly. We would give you steroids, we'd give you H1 and H2 histamine type blockers. We would also give you fluids and plus or minus epinephrine. Typically we give epinephrine if there's anything that could potentially compromise your life, including your airway or your blood pressure or cardiovascular output. These are serious things.
The brakes are shot, the engine's rusted, the only thing that works is the siren.
I can tell you as a healthcare professional, the sound of an ambulance, sometimes I hear it, sometimes I actually don't. I hear it so often I tune it out. There's a reason why. It's to get aware that there's an ambulance coming, besides the big, huge rig that's in shiny lights.
Guess what? Your husband is now an ambulance driver.
Don't you need training for that?
So you do need training just to be able to drive the ambulance, because there's all different types of buttons in there and what to do, and radios and how to actually speak to somebody over a radio from the dispatch center, know where to go. You need to know the area that you live in or that you're dispatching from to be able to get to houses quite quickly or to places quite quickly. Typically, ambulance drivers are also medically trained because they have dual purposes. And a lot of these are actually truck type vehicles, so actually might need a different license.
Hey, I've something that's cool. I can defibrillate Lisa. Not if I pump your heart full of morphine first.
Oh my gosh. You definitely have to have a higher level of certification. EMT intermediates as well as paramedics have different ranges of medications that they can actually give. And in other countries, obviously, there's different regulations.
Those aren't your toys. They're to keep Daddy asleep and awake. I'm gonna need him on my first ship tonight.
So those are the old school defibrillator paddles. We use pads now, but those are the paddles that actually have buttons. Obviously, you just manually do it. It's not going to hurt you. You just have to make sure that there's a conducting gel. It just has to do with conductivity, just like what we would use for ultrasound, where you need the gel to be able to see your image. Then, okay, you don't have willy-nilly needles and syringes and meds ready to go like that. There are meds ready to go, but you actually then have to either reattach it to a specific needle to give medications like that.
We're gonna fix it so you guys save the Dean's life.
Should we correct for wind resistance? Possibly. What do you think?
Oh!
Oh my.
A lot of times people get hit by cars. They can have a femur fracture, a tib-fib fracture, open fractures, closed fractures. So when we say somebody has an open fracture, it means that it actually popped through the skin. It could be as small as a puncture hole versus like no skin left.
I'm really sorry for the running you over prank.
Prank?
And all those other pranks were my idea too. I'm the one who should be expelled.
Well, I'm touched by your honesty. And who knows, perhaps I've been a bit of an ogre myself.
Yes, you have.
How's this? I'll readmit your friends and we'll forget this whole silly incident ever occurred.
Oh, Dean, this is what your new hip is going to look like. You're going to have to go easy on it.
Oh my gosh. So he ended up hitting an individual and causing a hip fracture, but that's open fracture. And then when you say it's a compound fracture in the media or you hear it, it just means that we would call it something called comminuted, which it's just a lot of pieces, okay? And then we describe it as either overriding, angulated, displaced, all these different descriptions we would use in our documentation. You can have a significant amount of bleeding with femur fractures as well as pelvic fractures. So you do have to be aware of that because we have a lot of bone marrow in those areas and a lot of major blood vessels within the pelvis and around the femur. So a lot of bleeding could happen.
Dr. Nick Riviera. Remember me?
Well, if it isn't my old friend, Mr. McGregor, with a leg for an arm and an arm for a leg.
Attaching different appendages, an arm, leg, obviously that's not what we normally do. If somebody loses fingers, maybe a thumb, sometimes they're actually toes get transplanted up into the hands to help with the dexterity of your hands versus your feet.
I'll Heimlich you, sir. Just be still so I can embrace you from behind.
So Heimlich maneuver, typically you're going to ask somebody if they're choking. Universal sign for choking is this. Tell the person that you're going to do the Heimlich maneuver. And so you actually take one of your fists. You want to put it in your subxiphoid area, grasp it with the other, and you're doing thrusts to pull in. And the idea is that you're trying to actually expel it out.
You're safe now.
Yeah, no. If somebody passes out, you do not lay them in this type of position. You put them on their back and you actually start doing the same type of thrusts into the same area.
Eat my dust, mortals!
Oh! Getting the leg stuck in the rim, you could dislocate the knee, or you can fracture the tibial plateau. You can fracture your patella, which is your kneecap, and then possibly femur fracture, but that would be pretty hard to do in that situation. Oh my gosh! Falling down. Obviously, hitting the head, compressive force could break it further, can cause compartment syndrome of the lower extremity there, where the tissue swells so much that you can't get blood flow to the distal tissue, and then it's a surgical emergency. It needs to be cut open.
Homer, I'm afraid you've torn out your anterior cruciate ligament.
There you go. Nice. So if you do rupture your ACL, there's going to be a ton of swelling. If you have partial tears, not as much swelling. The knee is going to significantly swell, a lot of pain. You want to get the MRI to get a definitive diagnosis, but with so much swelling, it's initially hard to see it.
Now, how did this happen?
Maybe a little morphine would refresh my memory.
I've talked about this before. We don't randomly just have syringes of morphine in our lab coats. At hospitals that I work out, there's a Pyxis machine. It's a brand. It is a locked unit where the medications are. Emergency medicine doctors do not have access to that. Only the nursing staff does.
I don't know. I'm still a little hazy. Oh, yeah.
Morphine hits the mu receptor, which tells our body not to pay attention to the pain. I love these scenes, these OR scenes. Your arms wouldn't be exposed, you'd be in a full gown, and his airway would be protected either with an intubation, an LMA.
So many times we've seen our father go under the knife.
One more and I get a free hysterectomy.
Punch card for a free hysterectomy. Hysterectomy meaning removal of your uterus. They're in a viewing area. Typically you wouldn't have that for families, but in teaching hospitals, big university hospitals, they do have these areas where students and residents and other supervising doctors can view the surgical room.
Now, Homer, you'll have a full recovery from your spinal cord injury.
What spinal cord injury?
Oh, he fell off the gurney.
A gurney is a fancy word for basically a hospital bed. Many of the hospitals I've been around, they do everything humanly possible to prevent patients from falling. Very rarely does it ever happen.
But it will take plenty of time and rehab before you can go back to work.
Miss work, but my life would be nothing without the nucleon plant.
After you have major surgery like that, especially in orthopedic surgery, rehab is really important. You want to strengthen everything around the injury. That way you give it the best support so it can have a longevity.
Oh, you're also responsible for this hefty hospital bill. You shouldn't have ordered all those hospital haircuts.
You have a hospital bill. I don't think I've ever actually seen one for one of my patients. That is a different department. It's a billing department. Obviously, hospital bills, it's always a point of contention. It just depends on the plan with the hospital, insurance, in-network, out-of-network, all different things, what country you live in. It has so many factors.
Well, you don't have to worry about the bill. We've never welched on a... Look, a bear! Run!
Oh! And there's a bear.
Oh my God, bear is driving.
Now, have I ever seen a bear come to the emergency department? No, obviously. Most of the wildlife injuries that I see are potentially rodents, dogs, anything that somebody might have in the house, a cat. Typically, you're not seeing too many wild animals. Whoa.
Wow.
Looks dry.
Yes. You're gonna immediately cause burn wounds to your tissue if you try to go down this. Flesh is gonna come off. Oh, jeez. Oh, all right, we got water flow. Woo!
Children, behold the deluge. For today we punch fear in the face and steal death's girlfriend as we truly live for the first time.
Oh, only one way down now. If that were to happen, how many of you out there would figure out a way to get off of that or go down the slide? Let me know in the comments. Oh my God, I don't think that is safe. I'm not telling anybody to do this. At least you're on the mat, so you're not getting burns to your own tissue underneath, so that's probably good. Man, the fact that they're actually getting air and then landing, I think about tailbone injuries, aka toxic injuries. Look how much fun they're having. I love it. Oh, geez. I don't know how good that water was.
I knew you guys could have fun here.
Yeah, nothing gets the heart pumping like a brush with... nothing.
Uh-oh. I knew it.
I knew it.
Instantly change color. So I have patients that will come in that they just don't look the right color. Typically they're either green or they look like a hue of gray. Our job is to know what sick and not sick looks like.
I don't feel so good.
The quiet rivers in my tummy are becoming raging waters.
Upstairs or downstairs?
Both!
Uh-oh.
Out of the water!
Out of the water! Don't want them to accidentally have diarrhea in the water. Our poop has always got lots of different bacteria in it, and E. coli is one of them. If something is causing you to have diarrhea, it could be not just your normal bacteria that's in there, but it could be a virus, it could be a parasite, a different type of worm, like all different things.
Bart and Lisa will be fine after a little TLC. By TLC, I mean taking Lorexocortisone. And by little, I mean a 4-week intensive regimen.
Cortisone is a type of steroid. If you're having inflammation of the skin, you can use it as topical. It also helps with itching. Typically wouldn't want to use a steroid internally because it actually then calms down your immune system and doesn't allow you to effectively fight off infections.
Steroids? Are there any side effects?
Nothing serious. Maybe a little temporary weight gain.
Yes, there are long-term issues of chronic steroid use. You don't want that. Typically in the emergency department, we're dealing with 1 dose for anywhere between 3 to 10 days.
Sweetheart, your friend Ray is in your head.
Ray wouldn't fit in my head. He's a human man.
Sometimes the misunderstanding of thought could be related to schizophrenia, where you're hearing things that might not be there. And if you do, definitely talk to somebody about it and just make somebody else aware.
We'll laugh.
Oh, really be careful on a roof. You can fall and you can really hurt yourself. Certain heights, if you fall too high, you're at risk for having major traumas. Okay, all right. You worry about, obviously, vertebral fractures all along the spinal cord and then a spinal cord injury. You can break even just your spinous processes, your transverse processes. A lot of different areas can be broken.
What's going on? Where are my shoes?
Struggle all you want, Homer. There's nothing you can do.
Totally inappropriate way that a doctor approaches somebody who is having the need for physical restraints. No, you do not laugh. Typically, you don't want to leave somebody in these type of restraints because it actually increases risk of injury to themselves.
Why?
Oh my gosh, and patients do spit. I'm not kidding you. The way that we prevent somebody from spitting is you put a type of mesh sock over top of someone's head that you can see through, they can breathe through. It's mesh, but it catches all spit. You don't know if somebody is carrying diseases and could be endangering others.
Excuse us for a moment.
Go! What am I doing here?
Not appropriate by the doctor, but sometimes you feel that way on the inside, but you don't act on those type of urges. You use different types of medications that can help sedate somebody or put them in a state of relaxation.
I'm afraid this calls for electroshock.
Electroshock?
Actually, the technical term is electroconvulsive therapy.
Well, that's a world of difference.
ECT, typically used in somebody who has schizophrenia or bipolar or severe depression, using electrodes and energy to cause a very localized electrical impulse to the brain. Major side effect ends up being a type of amnesia, but then typically clears out.
Light me up, Doc.
When you're getting juice, can you hold my turtle? I want to bring him back to life.
It's not like the same amount of energy that you're using to defibrillate somebody to shock them back to life.
Homer, that's just to bite on, not to eat.
Sorry. You mean one that doesn't taste so good.
That was rubber covered in Vaseline.
Marge, write that down so we can have it at home.
Oh my gosh. Probably shouldn't be eating things that aren't food. Things that are not made specifically to be digested by your stomach and used as nutrients in our body. Please avoid those things. Even the Vaseline, yes, please avoid those. So it does not happen that way at all. The electrical energy is quite short and in spurts, and a lot of times patients are actually sedated so they don't have all these abnormal movements. Nitrous oxide. People don't easily sneak around the hospital, and then even more don't have easy access to controlled gases. Nitric oxide, we typically refer to that as like laughing gas, right? And the hospital is all dark, like it's shut down. The hospital never shuts down.
Never!
Obviously, jumping right to the laughing gas component. Did you actually know historically the individual that discovered it was actually using on himself? Chemist Joseph Priestley would actually have like laughing gas parties to just see what would happen.
He who laughs last laughs dead.
What? Too much nitrous oxide. How does it actually kill somebody? So you have nitrous oxide, but then you don't have enough oxygen into your tissues. And then chronic use can cause brain damage, can cause seizures.
Is your knee really gross under there?
See for yourself.
Yeah.
That is. The wound to his knee could be mostly from trauma, injury, fall. Typically a wound to your knee takes a little bit longer than say it was on your thigh, only because it's a joint where it keeps bending.
Can I touch it?
No.
Sure, go for the gusto.
It's healing over my hand.
What?
It knows you're afraid.
It doesn't grow like that. If it does grow like that, maybe we got something like The Last of Us going on. If something is growing or moving on tissue, get to the hospital immediately.
Hello, I would like to take advantage of your baby prison.
Make sure if you ever use daycare that they are licensed, that they are true business, and they are covered with insurance.
Welcome, children.
We're calling it daycare.
Yes, whatever, just take them.
Oh, aren't they sweet? Any medical things I should know about?
Yes, probably.
Asking if there's any medical issues. You want to know if there's anything that they're allergic to. We do get a lot of people that will come in from daycares because they're kids, they get sick, and if one gets sick, a lot of them get sick. You worry about pinworms, head lice, everyday cough, cold.
Why, Homer, your surgical incision is completely healed.
I owe it all to my rewarding work with children and not picking at it.
Please don't touch other people's wounds without appropriate PPE, aka gloves.
Ah, yes, how is your daycare center doing?
Wonderful! Being with those kids gives me a high only morphine can top. You got any?
Some people seem to have an affinity towards the feeling that an opiate gives the body, hence that's why we're in an opiate crisis, while others, it's the opposite. It doesn't make you feel good at all and makes you feel off.
Always with the morphine.
Oh my gosh. What?
What?
Totally inappropriate. We don't have that laying around. Actually, physicians do not have access to this type of medication. It's actually in machines that are locked. Fingerprint access, that way it actually logs everybody in and out and how much has been taken out or put in.
Mrs. Krabappel, I'm done failing the test. Can I please go to
He
the
looks
nurse?
sick. What doctors should be good at is recognizing sick versus not sick, especially in emergency medicine. Obviously, there's a gray area, but you really need to get good at being able to recognize this.
Gosh, Bart, maybe you really are in pain. Well, it would be cruel not to let you go. Now you may go.
Somebody who's looking bad at school should immediately go to the doctor's office or the hospital. They're not going to just sit there and have you wait and see what happens. So call your parents to get you to go to the hospital.
Lunch Lady Doris, why are you here?
Budget cuts. They've even got groundskeeper Willie teaching French.
I don't think the lunch lady is qualified unless the lunch lady does have some former nursing degree that she has reactivated or has stayed up to date with all of her continuing medical education. Obviously, smoking in a school, can't do that.
Look, my stomach really hurts.
All I can give you are these chewable Prozac for kids. Your choice. Manic depressive mouse or the bluebird of unhappiness.
Chewable Prozac for kids. So no, Prozac is an antidepressant. They look like the Flintstones multivitamins. No, you would not take that.
Superintendent Chalmers, I'd like you to meet our new school nurse, Lunch Lady Doris.
Yeah, nice to see you. Seymour, why is that student lying unconscious on the floor?
We can treat underage individuals as long as there is consent by the parents via the telephone, or if it is, within the scope of what any normal worried parent basically would want you to do. If a pediatric patient is in cardiac arrest, but you don't have consent to do CPR, you're not going to not do CPR because a normal person, an individual, would want you to do that.
Unexplained bacon.
Unexplained smells could be something to be worried about. If you're smelling something that is consistently not there, the question ends up being, is there a brain tumor there or not, aka cancer? It could be a stroke. People do sleepwalk. You have to be careful with that. Some people are a little bit more apt to doing that than others.
Good old table.
Being jammed into the edge of the table, depending on where you get hit, you can actually injure your groin.
My groin!
You can actually cause bruising to the lower abdomen and also cause injuries to the internal organs, depending on how hard you hit into the table. Oh, what's happening? We don't really actually see too many fan injuries. You think about fan injuries like the guys on Jackass, where they're jumping into it. You can actually just cause bruising, maybe a broken bone. Sometimes you can actually lacerate the tissues. What is happening?
Homer, you're
alive! Yep. Man 1, machine 0.
You would think that type of fan, he would get chopped up in pieces versus these superficial abrasions that we see to his arms and face and body.
How do you like that score?
Oh my god! His brain looks like bubblegum. His brain is out so everybody can see. Skull fractures. It wouldn't be necessarily bulging like that. If this does occur, probably want to have some like wet gauze, something sterile wet to cover the area and get that person to the hospital ASAP.
We have to disable its central processor. Come on!
Oh my gosh, the brain is still hanging out. I've seen many injuries and a lot of brain matter. It's grayish white tissue that's super soft and super fragile.
Die, you monster!
Is that like the water?
Water softener.
Well, I am missing the back of my head. I think you could cut me some slack.
Back of the head, typically back there, it's visual cortex area. Also has to do with the balance center of the brain. So you're gonna be off, you're gonna feel like you have vertigo. Things might not be working correctly. You might have inability to do different movement.
Television broken?
No, there's a badger in there.
Badger my It's probably Millhouse. Millhouse!
Animal and human bites. If they break the skin, first we need to worry about if there's rabies or not. There's specific animals, raccoons and skunks and foxes.
Lions and tigers and bears.
Obviously, we always think about dogs and stray cats and things like that, but typically they don't harbor it, especially here in the United States. A lot of screaming for his injuries. You worry about infection. You have a difficult time trying to clean it out because it's a puncture wound and it's tight tissue. Typically, we'll actually put people on prophylactic antibiotics.
It's a badger, all right. Or possibly a griffin.
Depending on where the lacerations are, you may or may not end up closing them. It's always taught in medical school and residencies that you do a soft closure, meaning that you do every other stitch versus the normal stitching, because if you stitch it too tight, you can lock in bacteria.
We should call a doctor about this.
Oh, Nelly.
Oh, Nelly.
Oh my gosh, that is freaking hilarious.
How did the badger do that without ripping your shirt?
What am I, a tailor?
Removal of the abdominis rectus muscle. You're missing the omentum, which covers all this, because now we got small intestine, which is down on the bottom, transverse colon, and then what it appears is the stomach just above in the pink area. Then you have your liver and the heart. Super cool. Great depiction.
Mom, Dad.
Yes, Lisa.
What?
I've been listening, and Dad stops breathing for as long as 5 minutes.
What? You shouldn't be pausing for 5 minutes. 5 minutes, you would be dead. Typically, people who have obstructive sleep apnea, OSA, you're impeding your own airway for whatever reason, and you're choking yourself, so you're actually not getting good deep sleep rest.
The doctor gave us this machine to help him breathe in his sleep.
Nice.
I'll take care of him.
Actually, that's so good. CPAP stands for continuous positive airway pressure. Continued amount of air being pushed at you while you're sleeping through this mask to keep your airway open. Oh my gosh. You need to be trained on how to use these. People definitely feel like they're suffocating when you actually put these on. Marge hasn't gotten good sleep, and over a long period of time, it's definitely going to mess with your energy, your focus. So please make sure you get rest. You know, I try to get 7 to 8 hours of sleep a night. AOL rules. AOL?
America Online.
Does anybody know what AOL is who's watching this? AOL was like the original instant messenger.
Cool. Mom's on drugs. If we turn her in, we can get a form letter from Dick Cheney.
She's not on drugs. She couldn't sleep because her dad's chronic snoring.
I actually have a supplement that's perfect. It's called Do Not Disturb, and it's actually a sleep aid. Definitely check out my supplement company, Life Happens.
I'm taking him to Dr. Hibbert's this afternoon. You know how hard it is to get a doctor on Wednesday morning.
Oh man, that's so messed up. Doctors do enjoy golfing. I guess that is a stereotype, but not bashing in mailboxes. That's quite wrong and illegal. It is quite difficult to get a visit into a primary care doctor ASAP, and that's why the utilization of the urgent care and the emergency departments are high. Whoa, he's got a bucket stuck on his head. Oh my gosh.
Sorry, Dad. It just won't budge.
I tried greasing the bucket with bacon fat, but your father kept eating it.
Oh my gosh, that's hilarious. Not a bad idea. Try to lube up the sides to try to get it slippery so you can get it out. You wouldn't want to cool it down because that would actually constrict.
Well, couldn't you try a non-delicious fat? Oh, there's no such thing.
Oh my gosh, an x-ray. So trying to get an x-ray of metal, you aren't going to see anything through that.
I sort of have a problem seeing through lead.
If it was more plastic, it would look like this. If it was metal, you wouldn't be able to see through.
Beneath that bucket, he's more glue than man.
We actually see glue injuries often, but the worst ones that we see is when somebody actually uses crazy glue as eyedroppers and their eyes are sealed shut.
So he's stuck like this forever?
Here in this situation, there's going to be a way to figure out how to get this glued helmet bin off. You could actually fix this.
These days, the victims of comedy traumas, or traumatides, can still lead rich, full lives.
Oh my gosh, that's really funny. No, you'd be dead with all those holes. The fact that he's drinking and is going out through his chest, that means that the water's going mouth, holes in the esophagus and stomach that then lead into the cavity of the abdomen and the thorax. Nope, that wouldn't make any sense.
That don't make no sense.
The dog bite, you probably have an infection for a very long time and the tissue would fall off. Didn't remove it, which is good, but it needs to seek medical help. Could it be straight through the heart, but not allowing all the blood out, and that's why he's still alive? That's probably very realistic.
Sorry, but these guys crack me up.
What guys? I want to see the freaks.
I've never had anybody come to the emergency department with something stuck on their head, but people have objects stuck on different body parts. Usually it's related to the nether regions of different things that could happen. So please do not do that.
Your spine is more twisted than Sinbad's take on marriage.
I feel like we're missing. That's funny.
That's pretty funny.
There's a big spot where there's a vertebrae missing. I don't know if he injured himself. It also looks like bad scoliosis. If you have really, really bad scoliosis, you actually need to have surgery done. There are other therapies, physical therapy, other modalities that might be quite helpful.
Just give me some drugs and surgery.
Oh, I'd love to, but to be honest, modern medicine has a lousy record of treating the back. We spend too much time on the front.
Well, that is true. I will say that we do our best trying to fix pain that people get in their back.
My back!
But it is really difficult. You have a lot of nerves.
I'm going to send you to my chiropractor.
Hey.
Oh?
I thought real doctors hated chiropractors.
Well, that is our official stance, but between you, me, and my golf clubs, they're miracle workers.
Chiropractors have their place. Emergency medicine doctors have their place. Acupuncturist has its place. All different modalities are good. It's just when you do one all be all and say that this is going to do everything for me, might be a little bit misdirect.
Less yakking, more cracking.
Now, Homer, we don't actually crack backs. It's merely an adjustment. Okay, you're gonna hear a loud cracking sound. There we go.
It feels a little better.
They do feel better. Sometimes there is something that might be a little off and you need to get the correct alignment, so to speak, to allow your body to heal itself. So chiropractors, they focus on nerve flow and that homeostasis of the body and the patterns.
Now, I'll need to see you 3 times a week for, many years.
The body goes back into positions that it is used to. So you get adjusted, but then you have all the musculature and the fascia and the nerves that all say, no, I want to be back in the position that it was. By doing multiple adjustments, you're trying to convince the body, like, no, you got to be back in this position. Careful. Don't want to mix stuff together. All right. That shouldn't mix together. I don't know, all these weird chemicals. Oh, geez. If you mix bleach, Clorox, with ammonia, that actually produces a horrible gas that is very detrimental to you and very, very dangerous. So please don't do that. Oh! Your body weight when you fall is actually quite heavy. You could cause a skull fracture, a cervical fracture of the neck as you extend backward there, and then also the other component of an intracranial bleed that you always worry about. Oh,
she's opening her eyes.
Oh, my head feels like it was punched by a boxing man.
Yep.
How many fingers am I holding up?
2.
Very good.
He's He's holding literally 2 fingers. We see people come into the emergency department with exposure to different types of chemicals. They don't feel well, they're lightheaded, they're dizzy, they're coughing, and we have to try to figure out, okay, what chemicals did you mix together or were exposed to? What type of byproducts could be affecting you and your body?
Now I have a question.
Yep.
Who are you people?
Oh no, got amnesia.
Where am I?
This does happen. We see people who get traumatic brain injuries and they have amnesia and they can't remember. Sometimes we call it transient global amnesia. Comes on and then actually slowly comes back, versus retrograde amnesia where you can't remember anything in the past but you remember it in the future.
When will Marge remember us?
It's hard to say.
Yeah, you don't know exactly when it'll come back or not. So you just have to kind of bear with people. Sometimes when you have surgery and you're like, oh my gosh, it's already over. What happened? Well, we gave you a medication, typically a class of medicines called benzodiazepines that actually cause amnesia.
With retrograde amnesia such as this, the patient could forget years and years of
There
her
you go.
life.
Most of the time in the emergency department, we see it with a lot of head injuries due to like motorcycle accidents or car accidents where people just are repetitive and they're repeating things because they can't remember that we actually asked them and talked about these things.
Marge, I'm gonna take care of you until your amnesia goes scramnesia. I got you flowers, fluffy pillow, and a nice relaxing private room.
You gotta maximize space in a hospital. The hospital that I work at, some of the rooms are semi-private versus private rooms. It actually just depends on the level of care, actually. In the ICU, it's just 1 person per room.
Oh, you're sweet. I'm lucky to have such a kind, uncle.
I'm your husband.
Oh, jeez.
What?
I am. We're the same age.
But you're so much more ravaged than I am.
Oh, jeez. Different things can age us. Smoking, drinking alcohol. It depends on how taxed your system is, plus your genetic makeup.
Right, like Bundy. Hey. Oh! Whoa! Hemorrhage mundo!
Hemorrhage mundo. Oh my gosh. Laceration with glass, and then the way the blood is squirting, it looks like arterial. Compress that area, hold it tight, raise it above your heart, get that bleeding to stop.
Hey.
It becomes lightheaded, slipping down to the ground, having a near sinkable episode because he hasn't totally gone out. He could be losing too much blood volume super fast. First of all, I want to say, you see a lot of cartoons with these really sweet bandages on the head like this. I will tell you, from a real life perspective, they're really hard to keep on somebody's head.
Dad, you've been in a coma for 3 days.
They had to feed you through a tube.
That's not how that works. If you do need a feeding tube when you're in the hospital, if it's a short term, you have a nasogastric tube or an oral gastric tube into the stomach and you can give nutrients that way.
Now, why don't you stay for dinner? It would be my pleasure, son. Send up 2 hams.
That's hilarious. There is a tube system in the hospital. Tubes. Where we send like lab work and paperwork and maybe even meds to different areas of the hospital.
Come on, Homer, act all stupid, like you do on TV. Yeah, come on, dum-dum, do something unintelligent there.
These guys are enjoying some beverages at the bar. If they're having too much, don't forget, Life Happens. Check it out. Poor Decisions, a supplement that you can take that can help reduce the effects the next day of a good night out.
I'm not your clown. Don't diminish me.
Aww.
Gentlemen, I bid you farewell.
Oh! I mean, it's not funny. That's so dangerous. You have to be careful. Reminds me of Jackass. It can cause strangulation injuries. You can lacerate your vessels of your neck. You can cause compression of your vessels of your neck and decrease blood supply to your brain. A lot of bad things can happen. Or that. Flying through the air, depending on what you hit, a head injury, break a bone, internal bleeding, a lot of different things. So if you came to the emergency department, probably do a CT scan of your neck with contrast to make sure that the vessels are intact and you don't have any tears.
What's he gonna do for an encore? Ooh, I don't think he'll be doing no encores for a while.
You also worry about swelling of the airway as well. If somebody starts having like a hoarse throat, difficulty breathing, you probably put a breathing tube in sooner than later. Oh! The amount of people that come into the emergency department and tell me that they have been bitten by a spider, yet none of them have actually seen the spider bite them. There can also be a clogged hair follicle that leads to folliculitis, which then leads to maybe an abscess. Oh my gosh. Be careful with sprays for insects, spiders, all these chemicals around the house. There's warnings because they are harmful to humans. Sprayed into his eyes, you immediately see a lot of irritation. Oh man. Either he dislocated his knee, fractured something in the lower extremity, or he injured his back.
Where's the pain? Oh, there it is.
Maybe a couple seconds before you actually notice like the pain, and then it sets in. That's just normal how our bodies react. It just takes a second. Oh my gosh, and a big spider. Oh gosh. So garage doors these days have sensors when they're automatic, so this probably would not happen, but he's getting hit in the neck, which you worry about cervical spine injury, as well as crushing somebody's airway, aka the trachea. It's not like it's a malfunction. George just pushed the clicker to get it back up. He looked dead.
He's dead, Jim.
He's blue in the head. When we see people like this, they are not breathing or living.
I learned CPR while waiting for other kids to finish their math tests.
There we go. So interesting. Good job, Lisa. Look, listen, feel. She's looking. She's trying to feel for her pulse. She's giving a rescue breath.
Compress his chest.
I'm on it.
Not the right way to do CPR. If you find somebody unresponsive, please shake them, check to make sure that they are actually unresponsive. If they are, please have somebody call 911 or somebody go get an AED. Then you're checking for a pulse. You're also looking and trying to feel if they're actually breathing.
What happened? Where am I?
Typically, if you're not trained in CPR, you can do hands-only CPR, where there is no rescue breathing, and you just start doing chest compressions between the nipple line, middle, and you're doing it at about 100 beats a minute to say a rhythmic song of like staying alive, staying alive, staying alive.
It's all right. It's okay.
You wouldn't believe what happened to me. I tried to do it. You told me to do it. What happened?
Not too often do we have people wake up from a cardiac arrest and get up and walk around and move around. Yes, there is some confusion, but when we get people back, so to speak, from cardiac arrest, which is unfortunately rare, they're actually still in a pretty bad shape.
Look at this mess. I told that boy 1 billion times to pick up his jaw.
I say that all the time. Son of a... Falling downstairs. It is super common. I always ask, are they carpeted stairs? Are they wooden stairs? Are they concrete stairs? How did they land? What's hurting them? Basically, you have to poke and prod the whole body just to make sure that there's not an area that isn't hurt.
I like to play with you. There goes my back again. I like to play with you. I like to play with you.
Back pain just is awful, and especially if you can't get up. We worry about something called rhabdomyolysis because you can have muscle breakdown when you're on the ground for a long period of time.
I like to play with you. I like to play with you. Get help, boy. I like to play with you. I like to play with you.
You know, that's why elder people have the life alert button. If they fall and they can't get up, this way they can call 911 and somebody can come to the house and assess, either just get them up or bring them to the hospital. Oh, fun. During my residency, they actually opened up a trampoline park right near it, and we had so many people come in with fractured ankles, dislocations. It was impressive. Oh! Trampolines are notorious for causing injuries, sprains, strains, fractures, and dislocations. I've had people come into the emergency department after falls, landing on weird objects and severing their spinal cord.
Otto, you okay?
Yeah, just pop my shoulder back in. Thanks, buddy.
Oh my gosh. Typically, dislocations of a shoulder, you can get it back in without medications. Putting it back in, you can cause a fracture of either the proximal humerus or glenoid fossa, the rim.
Ow! I bit my tongue.
Biting your tongue, whew, painful. It can bleed a lot and actually really hard to sew back together. So hopefully it's not a big bite, especially kids. They got braces on, even more apt to have like laceration or injury or bleeding in the mouth.
Ow!
Oh.
There, that's 6 years worth of inoculations.
Holy cow, oh my gosh. There's been studies to show that there is positive benefit to the use of vaccines, but giving them all at once to a poor kid, that's always up to debate, and it's a good conversation if you're a parent to have with your doctor. I don't give out vaccines as an emergency medicine doctor outside of, say, your tetanus up-to-date shot. Occasionally we'll give other ones.
Here you are, my good man.
Giving the doctor cash, yeah, definitely not a thing.
And while you're at it, throw in one of those polio shots.
Ooh, yes, sir.
Yep, anti-polio.
Polio virus spreads person to person, messes with your nervous system, could cause permanent paralysis, disfigurement, and mobility issues. It is a good vaccine to have to prevent this virus from spreading.
Kids, come on. Thank your father for the injections.
Thank you, Dad.
Thanks, Dad, for the injection. Some of the vaccines do cause discomfort because of the volume that goes into the muscle, so it's uncomfortable, or if it's subcutaneous, different things like that. But again, the whole point of giving these different types of medications and vaccines are to help prevent disease.
Make your new piano mover.
Now we're gonna have to put a steel rod where your spine was.
Moving a piano and then you're gonna need metal rods. I think it's a big jump unless he's collapsed every single bone in the back. My back! And there's a structural problem relating to spinal cord. Typically putting that much hardware in somebody's back, you try not to do it unless you have to do that.
Will I ever move a piano again?
Oh my goodness gracious, no.
We see people with big rods in their spine, typically from really bad scoliosis that needed to be fixed. Most of the time, hardware that goes in people's backs is very small. But again, you're putting a foreign object in that area, and sometimes it really helps individuals, and sometimes it continues the pain, but at least somebody has a structure that they're going to be okay.
Perfect night! Voulez-vous coucher avec?
Oh, there goes the back. My back. You hear something pop in your back and you're like, oh, I did something wrong. You don't want to move. You stay still, which is fine. What typically will happen is whatever muscles are around that area, if some injury did occur, they will start to spasm out and actually try to keep you from moving as well.
Go! Dave! What's the... Go!
Ouch. Marge luckily fell every step of the way on Homer, so maybe protected, but hurts like heck. Have you guys ever tried to carry somebody and fallen? Let me know in the comments.
Marge, I'm afraid your days of walking are over.
Oh my God.
For about 36 hours.
Sometimes if you have a good rapport with an individual, you can talk like that. But in general, you just gotta kind of give it to them straightforward and let them know, okay, it's gonna hurt for the next few days. It might get a little bit worse and then it'll start to improve.
By then, this mild ankle sprain should be good as new.
There's different degrees of ankle sprains. It has to do with the ligaments that are injured. Typically, they're on the lateral aspect of the ankle itself, and usually 1, 2, or 3 of them are ruptured. It's just based on symptoms. You swell up a lot, you'll have bruising.
It's my fault. Homie wouldn't have dropped me if I hadn't put on a few pounds.
Nonsense. It's not your fault you're married to this.
What the heck?
Oh, and it was such a good date night.
Well, now it's a hernia morning.
A hernia morning.
See, you've got a tear in your abdominal wall and a section of your intestine is pushed through.
So that's cool. So we call those ventral hernias. You can have an umbilical hernia that goes through your belly button, but if it goes through the abdominal wall, we call it a ventral hernia. You can have a hernia of your intestines, or you can just have a hernia of fat tissue. Hernia of fat tissue is not dangerous. It could hurt a little bit, so sometimes they may actually have to fix it.
Fix it, fix it, fix it, fix it, fix it, fix it!
Aren't you going to chuckle?
An inguinal hernia is no laughing matter.
Oh, these are the wrong terms. So an inguinal hernia is the hernia down into the groin and typically goes through a defect that's already there.
Possible side effects may include hallucinations, irritability.
When a medication has side effects, they actually have to report every single side effect that had ever happened to anybody ever taking that medication. And so that's why when you get that pamphlet from the pharmacy, there's so many different side effects.
Inability to focus. Blah, blah, blah.
Homer can't focus. I know it'll help. Oh, check it out. Level up by Life Happens. This stuff will give you energy and focus.
Do not mix with alcohol. Fine, I'll drink it separately. Boy, give me a beer.
Please, if you're on a medication that potentially will impair you, don't add another substance that will also impair you, as well as it changes the metabolism and messes with the liver, so please be aware of that.
Wow, this plankton's only 33 cents.
According to the Mexican Council of Food, this expired 2 years ago.
Oops.
Sure, by their standards. But we live in America.
Oh, he's eating expired food. Please don't do that. Yes, it might be in a can, and people say, oh, it might actually last longer, but it does increase the risk of bad side effects as well as causing yourself illness. Typically, it would be a GI type issue.
Nocturnal cravings, a positive ultrasound.
There's a transabdominal ultrasound looking at the pregnancy. Pretty good.
How could this woman's doctor not know she was pregnant?
You'd be surprised. People do come into the emergency department and actually don't know that they're pregnant, and they've been pregnant for a long time. Some people say that they didn't feel any movement, didn't notice anything different, versus hormonal changes, mood swings, nausea, vomiting. Oh, yes.
A baby! An astronaut baby!
Wow. Obviously, that was the umbilical cord. Typically, that would be clamped off.
The clamps!
Doesn't matter exactly where you cut and clamp it. It just needs to be separated. And then that cord is then attached, not just to the baby, but it's attached to the placenta. And eventually, the placenta will also deliver itself.
You see, I've just sold the Lil Lisa recycling plant for $120 million. As my advisor, you're entitled to 10% of the proceeds.
Whoa.
Oh, but I can't accept that.
Lisa, why not take this $12 million? Come on.
Come on!
You did the right thing, sweetheart.
Wow. And so the monitor in the back is not really beeping very well. It's very slow. You'd expect that somebody's heart is beating a little bit faster.
Well, that's the first case I've ever seen of a man suffering 4 simultaneous heart attacks.
I'm sorry, Dad.
4 simultaneous heart attacks. Probably a different way to say that would be multiple blood vessels are all clogged at the same time. When you're having a heart attack, most of the time what happens is you have a small piece of the wall or a narrowing of the blood vessel break off, and then it causes a complete blockage.
Really could have used that $12,000.
Dad,
oh my gosh.
10% of $120 million isn't $12,000. It's
Code blue.
In the hospital, when you hear code blue, that means that somebody is either having a cardiac arrest or a respiratory arrest.
With this level of sour cream in your blood, your brain is completely starved of oxygen. Consequently, you're a moron.
Oh my gosh. Too much sour cream, meaning is there too much cholesterol, fats, triglycerides, inhibiting the brain tissue from getting oxygenated? Maybe. I mean, the picture of the brain, it's got all those spots on it, which could be ischemia, where there's dead brain tissue.
A perfect explanation, succinct and devastating. Infinite stars. Best diagnosis if...
Wow. The question ends up being, how did he drop dead? Was it due to a stroke in the brain or an immediate cardiac arrest? If somebody drops down like that and dies that fast, typically it's from your heart stopping.
Hey, Lisa, I dare you to drink the water.
Don't drink the water.
I'm not sure that is water.
Yep.
Chicken.
Quit it, Bart. Quit it. Quit it.
Bart, be quiet. Lisa, drink the water.
Good advice from their aunt. Don't start drinking liquids that you don't know what they are. It's a water at a park. Different things fall into it. They may not have a filtration system, so they probably need something to keep it clean from getting pathogens in there. So it could have a lot of chemicals in there. Whoa, could be infectious. Not a good idea. Could be toxic to a human, causing cardiac arrhythmias, cardiac arrest, hit your CNS, so your central nervous system, causing you to have hallucinations, could stroke out, may lose function of your bowel and your bladder. Just now hallucinating. Even drinking like water from like a really nice glacier, you got to be careful, can cause you to say like giardia, where you're gonna have like a diarrheal illness.
They're all around me. No way out.
Say you go camping and you need water, make sure that you appropriately sterilize that water, either heating it or special tablets or filters, those sorts of things.
What's wrong? Oh, you just put your head right here.
Oh, jeez. Say you're on a ride at one of these parks and you get a little bit of water splash on you. It's probably just fine. It's more if you start developing symptoms. Have yourself checked out.
Whew. Funyuns. Little Debbie's.
Not healthy snacks for individuals. Funyuns, high in salt, and then of course Little Debbie's, a very nice sugary treat. Sugar.
Look at the size of that bird.
Homer, I can't believe you're partaking with my parents.
Yeah, it's medicinal.
Oh my gosh. Okay, so I'm assuming they're talking about medicinal marijuana. Marijuana does have benefits that people use for medical problems, nausea and not being able to like eat. And that was mostly used a long time ago in the cancer treatment population.
You want some of my weed?
Oh, nice. In The Simpsons, they only have 4 digits. As humans, we have 5 digits. As you go across and swing, you're hitting with the lateral aspect of the hand. That's your weakest area, and it could increase the risk of having you snap the metacarpal on this hand.
I didn't know you were left-handed.
He hits what appears to be right in his eye, so you increase the risk of ocular trauma as well as all of the bones around the eye. And we get worried that somebody passes out after getting hit in the head. It could just be that your bell got rung, but again, you worry about like intracranial bleeding as well as skull fractures.
Homer, you will need to wear this eye patch for a couple of weeks.
Eye patches we will use at the hospital. Typically, we use them to protect the eye itself from eye trauma. Sometimes we'll want somebody's eye to stay closed because of like corneal abrasions or lacerations.
You may never see a film in 3D again.
But the storytelling is finally catching up to the technology.
When you have 2 eyes, it helps with depth perception. But over time, if you still only have 1 eye, you will compensate and figure out the depths thereafter.
I can't believe you struck my husband.
Marge, I've been racked with guilt and pain. My mustache fell out. This is a clip-on.
Oh my... I've used mustaches before, but they're never a clip-on. They're always one of those like taped ones to your face, so that's pretty funny. Stress could cause a process in your body to which hair could fall out, maybe not like perfectly fall out, but have areas of patches where it could definitely fall out.
Punch my eye, destroy my marriage. Now just pull a plug and let me die.
That's the plug for the light.
When somebody pulls the plug, they go into asystole, that flat line, right, that you see on the monitor.
Take your hands off my brother from another mother.
Oh, jeez. Oh! Shot straight to the chest, single bullet. It could go straight through the aorta, straight through the heart, straight through one of the lungs. Oh my gosh. So, real big thing at the hospital is they always make sure that the bed rails are up because you don't want people to fall out of the bed and have unnecessary traumas. And his IV came out and he put it back in. Yeah, you wouldn't do that easy. An IV could be disconnected, but the catheter would probably still be left in the arm itself. If the catheter comes out, it's a bloody mess because now you have a hole where there was a vessel.
Homer? What happened to me?
You saved my life, and I came here every day to make sure you pulled through.
Thanks, Homer. You're a true friend.
He doesn't have any chest tubes or any other bandages of tubes where you'd think, okay, they had to do major surgery. Hard to know what they actually did to fix him. Say you get shot in the chest and you're alive. Maybe it's just a soft tissue wound that went through and through and missed everything. But the likelihood is there probably surgery was done. Oh. Passes out. Oh my gosh. If you see somebody pass out like that, try to wake them up, you know, grab the shoulder and kind of shake a little bit and be like, hello, are you okay? Look to see if their chest is rising, see if they're breathing, check on pulse. Then you want to just get this individual to the hospital ASAP.
Young lady, you're not getting enough iron.
As humans, we can be deficient in a lot of different things. People can have a deficiency in magnesium. What I've done is made a supplement line called Life Happens. 2 of our products currently have magnesium in there. One of them is Do Not Disturb, which helps us sleep at night. And then we also have Chillax for the occasional stresses in our lives.
Please say it's the vegetarianism.
It's not the vegetarianism.
It's a little bit the vegetarianism.
Potentially could have deficiencies from your diet. Not as much anymore since there's such awareness about it and there's supplementation that is available.
I advise you to take these iron supplements. It's like swallowing dollhouse furniture.
The reason why you need iron is it has to do with oxygen and getting enough oxygen to your tissues. If you don't have enough iron, your hemoglobin and the red blood cells can't do their job because it's an essential part of that. Whoa.
North, please.
I'm not a fan of, hot peppers causing discomfort in your mouth and your stomach and the other end. I see people come to the emergency department with gastritis, which is inflammation of the stomach and pain due to eating things like this, so I try to avoid that. Oh, jeez.
I don't feel so good.
The thing we always worry about besides gastritis is something called peptic ulcer disease. You literally can form an ulcer within the stomach or the first part of your small intestine.
Flanders, you gotta help me.
Well, sure, buddy. I'd be happy to help out. What can I do? Doodly doo,
Oh.
doodly doodly doodly, hobbly 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 gobble gobble gobble.
Get a little altered. Altered mental status, visual changes, hallucinations. Maybe he's having bleeding in the stomach and becoming quite hypovolemic and losing blood and becoming altered that way because he's not getting blood flow to the brain. Oh my gosh.
I got him. You stink, Laboot. Damn it.
When somebody falls from 3 times your height, 15, 20 feet is when we start to worry. This is obviously higher than that. Then you worry about major traumas to the body, fractures, dislocations, ruptured organs, a lot of bleeding. Oh, jeez. Oh! That's like a big classic. You can actually cause a laceration just by hitting the head that hard. It causes the skin to split. Pretty easy to put back together. Use 6-0 or 7-0 sutures that are not absorbables. We don't like using absorbable sutures on the face. We like to use nylon. That way we're able to see the wound and we know exactly when the stitches are coming out. Typically on the face, we're going 5 days. Oh my. Nice. And then the other component is a nasal fracture. That is another thing we worry about. Typically, we don't have to fix it in the emergency department unless it's very much displaced, and then we can relocate it. But if it is quite subtle, then that is done thereafter by an ear, nose, and throat doctor or a plastic surgeon.
Costa Rica! Costa Rica!
Time to rockin'.
Oh! I don't know about you, but the billboard signs around me in California, they're pretty big. So I believe if somebody gets injured by one of those, it could cause a significant amount of trauma. Probably the motorcycle would cause more trauma to this individual. Contusion, maybe a fracture of the legs, just relating to how you fell and what body position you were in.
The results of your physical are very concerning.
Physical exams, they're good to do just so somebody's kind of monitoring you in the sense of you might say, hey, I'm healthy, I'm good, I don't need to go to the doctor. Part of it also is having a relationship with a doctor so that way when you need to see one, you have somebody to go to.
You're 80 pounds overweight.
I wore my socks on the scale.
There is some variation of scales versus we definitely, even in the ER, we weigh somebody with clothes on. So you're probably off by about 2 to 4 pounds, potentially, depending if you're wearing jeans or a jacket or a sweater.
And your cholesterol is sky high.
Go big or go home.
We actually do need cholesterol in our bodies. You don't want it to be 0, but if you start having massive amounts of high cholesterol that maybe is not dietary, you do get concerned of familial hypocholesterolemia.
Oh, and your testosterone is just a little bit low.
Testosterone? That's what fuels my punching and yelling. And my undeserved confidence.
Low testosterone, low T. So that could be for a lot of different reasons. Lack of production, lack of exercise, poor diet, genetics.
Don't worry. Low T is very common amongst men your age. It can be treated with a prescription drug called Vicodin.
Fill me up.
Just because a number is low doesn't necessarily mean that you need to supplement or take a medication for low T if you're not having any symptoms of low testosterone. Symptoms of low testosterone, it has to do with like lack of energy, lack of sex drive, malaise, not sleeping well. Canadian Falls. Oh. Oh no. I'm assuming they're talking about Niagara Falls. There's a US side and a Canadian side. The US side are really, really rocky. The Canadian side is the really nice one that you see in all the videos. Oh.
Okay, time to take a sick day.
Oh, see how rocky that is? Interesting. There is a statistic relating to Niagara Falls that roughly 20 to 30 people go over the falls every year and typically end up in a tragic outcome.
Where am I?
Oh my gosh. The Canadian beaver. Canada, yes, has a universal healthcare, free healthcare, which is great.
Miss Simpson.
Oh my gosh, I got an IV of maple syrup. Interestingly enough, sometimes you can actually do a maple syrup enema for people who are constipated. I do not recommend this at your own house, but there is a formula at the hospital that they actually can do.
Your daughter's fine, but I recommend a 5-day stay.
Of course. We'll take out a third mortgage.
Sir, you're in Canada now, where your healthcare is free!
Oh my gosh. Free healthcare, universal healthcare is obviously good for everybody, and it should be a basic human right. The flip side of it, the timely access to medical care that you might need in a universal healthcare system might not be as quick. It gets very, very complicated.
Which doctor are you here to see?
All of them.
Like most Americans, our insurance is terrible and has a giant deductible.
Which we just met yesterday.
Thank you, kidney stones.
Oh my gosh. The deductible basically means the amount that the insurance company wants you to pay before they'll cover any bill thereafter. They're going to get full checked out, get all their medical done, but they have one day because the next day the new year starts and then their deductible goes back down to zero.
Look, I went to the Krusty Land snack bar. I got 20 cc's of super silly saline.
People really love the idea of getting intravenous fluids. We get people that come in and just say they're dehydrated, I need an IV bag. It's a misconception that you're going to get significantly better hydration in an IV versus using your own intestines. This is probably an MRI machine. There are two things that we do worry about when you're talking about the size of a patient to get the imaging. Weight, one for the machine so the table can move. And then the other is the circumference around the abdomen or chest or shoulders to be able to fit into the tube. A hammer to the knee, you're just checking for deep tendon reflexes. Most people have normal reflexes. I don't carry a hammer on me. You can use the side of a stethoscope. You can even use the side of your finger. That is messed up. Long time ago in the United States, if somebody was too large for an MRI, they used to utilize zoos and other animal park imaging centers, but they don't use that anymore.
Treats it is. We'll even get one for Maggie for getting her eye test.
Oh my God. Pupils are quite dilated to be able to see in the back of the eye. Put those massive sunglasses on. The medicine's preventing you from constricting. You have so much light coming in, you won't be able to see very well.
Hey, look out! He's nuts! Look out!
Out of the way, Barishnikov!
Somebody at you!
He hit the star player.
Dad has the worst luck when he's drinking.
Oh my gosh. Okay, well, drinking and driving, no. Usually people only treat the aftermath of the dreaded hangover, but I think it's better to pregame with a support supplement. That's why I formulated Poor Decisions. It will help arm your liver and hydration levels and help you recover much smarter. Poor Decisions available at lifehappens.com and on Amazon. Oh my gosh.
Just a simple yes or no.
Typically in my own practice, if I know something's going to hurt, I'll be very gentle in that area. Sometimes we need to feel certain areas to see if there's like a mass, a bulge, or something else underlying. But again, we have imaging to also help us.
Son, I'm afraid that leg is hanging by a thread.
Lubchenko must return to game.
Oh, your playing days are over, my friend.
I wonder if he had like a massive like ligamentous injury, like your ACL, your anterior cruciate ligament, or is there a fracture, a tibial plateau fracture? Is there continued dislocation? Hard to know without doing anything other than just your physical exam. Oh my gosh.
I did it. My leg, it broke off.
As a physician, as a doctor, we tell patients, hey, this is our medical opinion. We suggest that you don't do something, but again, it is up to the individual to make their final decision. Same with medical care, surgeries.
Homer, do not press the core destruct button. Press destruct button.
Oh no.
Don't do it! Don't do it! You'll kill everyone! Do it! Do it! Kill everyone!
Oh man. We got 3 shots to the chest, so penetrating trauma. If the person still has a pulse at that point, obviously you're trying to save their life, resuscitating them, giving them blood products, making sure that they're alive.
Oh, you stupid son of a...
Oh my gosh. Obviously, we have a nuclear blast at this point. Things that you worry about, obviously, like the immediate vicinity, blast injuries, heat-related injuries, shrapnel injuries, radiation, shockwave.
Lisa, you don't look well.
Cheeks are swollen. Maybe febrile. Maybe she's got the mumps. Is there any exact treatment for the mumps? No, it's mostly fever control, pain control, anti-inflammatories. Tylenol, ibuprofen, soups.
And your cheeks are so swollen. I think you have the mumps. I'm calling Dr. Hibbert.
There you go. You have to worry about orchitis. You have to worry about oophoreitis, inflammation of the testicles or your ovaries.
Okay. No doubt. Doctor, I think Lisa has the mumps.
Well, Mrs. Simpson, much as I'd like to rely on your diagnosis, I think it might be professionally derelict of me to do so.
Be prevented by getting vaccinated. It's been around for a very long time, the MMR vaccination. Make sure you do go to your healthcare provider to get the appropriate diagnosis. Sometimes you can have single-side swollen face, which would be a dental infection, facial infection, or an inflammation of just the parotid gland itself.
Yeah, looks like little Lisa has the mumps. I guess you'll be missing a week of school.
Really funny. Okay, in the background, we see School of Medicine. The university should be there somewhere. Everybody's been asking for it. This is my diploma from medical school, so it does say the University of New England College of Osteopathic Medicine.
Now you get rest and have yourself a lollipop.
The lollipop probably has some citrus components to it, probably activate your salivary glands, could cause pain, or it might give it some relief. So sometimes it's hard to know the exact response that you're going to have.
I feel queasy. Don't stop, Millhouse. You're so close.
So really interesting. People feel queasy but grab their stomach. To me, that sounds like you might be nauseous about the vomit plus having abdominal pain. You can have abdominal pain without nausea. You can have nausea without the abdominal pain.
I told you we should have served cake instead of oysters.
Oh no. When you're at big parties, you do have to be careful of food that is out, especially raw food. Sometimes you have to worry about the mayo, potato salad, or macaroni salad if it's been sitting out. Oysters could cause you to get a bacteria in your body called Vibrio, which will cause a gastrointestinal illness, gastroenteritis. Could also lead to severe dehydration and even death. Treatment ends up being supportive therapy, nausea medication, medication for any abdominal discomfort, hydration if you need it. If you can truly identify that it's Vibrio, you might be able to get an antibiotic.
Homer, would you like to cut the cord?
My pleasure.
Oh, geez. Homer over here not wearing a mask, not having gloves on. But yes, they do sometimes offer cutting the cord to a family member or whatnot in the room. Of all the many deliveries that I have done, don't recall any family member cutting the cord.
It's so tough you can't cut it. Why is it like... Why, you little... Such a beautiful moment.
This is not how you would do it. You'd actually clamp it, 2 different clamps that are pretty close together. That way you stop the blood flow when you cut in between that. And you're gonna use pretty sharp medical scissors, so you're not gonna be chomping away at it and it's not going to cut. Oh, gotta be really careful with this. Right away, I think fracture dislocation of the ankle is gonna happen. If that doesn't happen, now you're having strangulation of that ankle, decreased blood flow to the foot, which could cause ischemia. Okay. Whoa, 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 what just popped in his neck? Holy cow, and it was a very disturbing sound.
You see, these boils on Homer's neck are pent-up rage. If Bart's trap hadn't set Homer off, the anger would have overwhelmed Homer's system.
What? Boils of rage. No.
No.
We will refer to them as abscesses, collections of walled-off infections within the tissue themselves, filled with pus, or what we call purulent material.
You mean I shouldn't punish Bart at all?
Why, if anything, he should punish you.
Poor Marge. She seems so stressed, constantly dealing with Homer and his shenanigans. If you're like her and could benefit from a little more chill, you should definitely check out Chillax by my company, Life Happens. Check out Chillax at lifehappens.com or on Amazon.
And I did it all without wasting money on one of those stupid welder's masks.
Oh, come on.
Come on.
How many welders are out there have had an arc burn to their eyes causing keratoconjunctivitis? We'll have people come in screaming in pain. Emergent treatment that we do in the emergency department is pain medicine, numbing medicine to the eyes, which will make somebody feel better. We have to do an ophthalmic exam. In these situations, we'll typically use a slit lamp.
And this little piggy went...
What?
Look, Marge! Maggie lost her baby legs.
Oh my God.
Oh. It's not like losing your baby teeth. You should not be losing your legs.
Come on, get off the...
Really interesting. There are some reflexes that little babies have that make them like super strong. If you put your finger in their hand, they grasp onto it and they literally don't let go, and you can lift them up. Typically, they'll hold right on.
We've got to get a doctor.
Absolutely not. No quack Sawbones is going to apply his leeches to me.
Leeches are sometimes used in medicine or alternative medicine. Sometimes it's for like bloodletting, to get blood out of your body. Sometimes to help heal a wound.
Mr. Burns is suffering from what we medical men call hypohemia. In layman's terms, it's quite simply a lack of blood.
Hypohemia?
Damn it, doctor, I'm no idiot. I know what hypohemia is.
Hypohemia. When somebody has a lack of blood, sometimes we'll say hypovolemia. In general, that's a decreased amount of blood volume. Could be related to dehydration. Could be related to decreased amount of blood products that are being made.
His blood type is O negative. It's quite rare.
Oh, O negative. We don't call it that, we'll just call it O negative. O negative blood type can only get blood transfusions from O negative individuals.
I'm B positive. Damn this common gutter blood in my veins.
Smithers, don't feel so bad. After all, that kidney you donated to me really hit the spot.
He has his kidney, even though they're different blood types. So there are scenarios where they might be able to make it work. Immune suppression, potentially. You have to be on immune suppressant medications, different types of other therapies out there. Oh, come on. That's horrible. Electric chair event. You see like the smoke, burning flesh, burning hair, smells awful. Probably not really good for us to breathe in. If somebody has asthma, it could definitely set you off and go into an asthma attack. So, not good. The idea, unfortunately, for the electric chair is to stop somebody's heart. Typically, when somebody gets this type of energy, you're basically going to cause somebody to go into either VFib or VTAC.
No. Looks to me like he suffered a lot, Chief.
Oh, geez, Lou. How long are we gonna let me keep drinking this thing?
Whoa, so you're drowning with frozen liquid. Cold exposure could slow responses down, breathing and swallowing. You can't get out of here, thus you start aspirating, thus drowning. Whoa. Oh my gosh. Took out Moe's hearts, which was actually quite small. Oh boy. And obviously it's pretty hard to do that because it's attached by multiple different vessels and protected by your sternum and rib cage, still beating outside of the heart. Could that actually happen? Maybe a couple beats because there's still electrical pulse due to ion channels that are, you know, still happening.
Show me what you got.
Oh!
Is that the best you can do?
What? An axe to the back, a full axe has a lot of weight to it. It could actually bluntly go through a lot of tissue, even if the blade isn't strong or say really, really sharp, can break bone and get into the lung there. What the? Interesting. Okay, head falls off. In the times when they used the guillotine, they had a theory that there was consciousness still there. There are action potentials that still happen. There's no way to actually study this because you can't just chop people's heads off and study if they have consciousness afterwards. It's inhumane.
Pardon me, coming through. Rest in peace. You're dead. Take a dirt nap. Feed the worm.
Anybody touches, he dies. Now, does that really happen? No, but there are instances of toxic chemical exposures, a combination of gases that people will actually just drop and die. You don't actually want to go in there without making sure that there is no toxic event going on, so hold off going into those areas. How many people out there have ever gotten poked in the eye? It's awful. The cornea, which is the clear bubble over top of the colored part of your eye, it's so specialized and highly innervated, lots of nerves, but very sensitive. Oh.
Did Shark do that?
Yes, he was testing out a new blood-based suntan lotion.
That is on the left flank. What's on the left flank over there? Your descending colon, your sigmoid colon, the kidney on the back, your ureters. Could you live if you're able to control the bleeding and sew it up? Yes, you might need a colostomy bag, which is a bag that you would actually poop outside of your body. What? Pulls out heart, stomach, esophagus. The anatomy of the heart looks pretty good. The stomach looks pretty good, but they're not connected.
Hey, you can't have that.
Oh, pulls out the spine. That is a depiction of the vertebral bodies of the spine, not the spinal cord. Oh my gosh.
This is gonna hurt. That's better.
The only time we ever see self-injection through clothes should be with an epinephrine pen, adrenaline, in case you're having an anaphylactic reaction. Most doctors do not carry syringes of medications on their person. Oh, this is like the Iron Maiden.
Iron Maiden? Excellent!
The Iron Maiden was a device, besides just being spiked, which typically didn't go all the way through, didn't kill you right away, unbearable for a long period of time. But from a historical standpoint, they're not sure if they were ever actually used. Oh my gosh. Oh, just... Sometimes we have people who are very fluid overloaded from congestive heart failure and they have a lot of fluid in their tissues, and we'll give them a diuretic or a water pill. If you give too much, you can actually get them to diurese, aka get all the fluid off too fast, and their skin will actually shrivel down. What the heck? That's crazy. Putting something in the microwave. What is the microwave doing? It's heating up the liquid water molecules and vibrating them, increasing energy and heat. Things not to put in there, anything that's living, as well as no metal objects. Please don't do that. It can cause fires.
Choreographed high-octane ultra fight.
Oh, in this moment, you all know what I'm gonna say. Don't pull it out. But my company called Life Happens, there is a code. Don't pull it out. 30% off. Definitely check out lifehappens.com for all of your as-needed supplement needs.
I would have taken a bribe.
If it's through a lung, probably causing a hemothorax and a pneumothorax. Typically, when somebody has like a traumatic injury to the lung itself, they're not big holes, but this looks like it could be a big hole. Oh! Bart is taking a knife to the head. Most knives actually will bounce right off because of the skull itself. They'll cause a laceration, bleeding, injury, but going through the skull, which is pretty thick, unlikely. Well, that's definitely not compatible with life.
He's dead, Jim.
We'll see traumas to the head, skulls are fractured, and then we just see brain matter. But a lot of times we continue the resuscitation because we work on A, B, C, D, E, so you don't get past C in a cardiac arrest, and so you're not looking at the fact that you have brain matter all over the place.
Nice try, Bob, but I'm sure you made some stupid mistake.
Oh, interesting.
Interesting.
Harpoon through the chest. You can actually see how Bart is slowly becoming more lethargic. That could be due to the fact of decreased pumping of blood to the appropriate organs, aka the brain. When the heart came out, you'd be like, oh, shouldn't he die right away? I've literally had people have heart attacks, heart stop, and they're still talking to me. Literally 2 or 3 seconds later, they pass out. But you do have a slight delay, very slight, but it could happen. So worst case scenario, you fall and have a cervical fracture. Could that kill you right away? If it's a high cervical fracture injuring your brainstem, it could affect your breathing apparatus and the information going to your heart. Outside of that, unless it severed your head off, you probably end up to the emergency department. Just pop a hole in it. That's why there's always these warnings in all these bags to not put over your head, because it could increase the risk of hypoxia and asphyxiation. We'll see people more in the sense of getting choked, and so we'll have to do different imaging relating to the neck. Look at that neck!
You missed my heart. Attaboy.
Oh! The intestines are not so free-flowing like that. They're covered by omentum. You have the liver that's in the right upper quadrant, and then you have part of the stomach. You have all those small intestines, but they're attached by mesentery.
You even taste disappointing.
Half of that taste is you.
Whoa! Loss of limb. Everybody out there who watches this channel, you guys know if your limb is removed accidentally, you need to use a tourniquet. Get that blood under control. Get to the operating room.
Choke!
Oh my gosh, the choke cam, that's not funny at all. Universal sign of somebody choking is what Homer is doing. Nobody's helping. What would you do? Ask the person, are you choking? They will be able to shake their head yes or no. And then you would engage in saying, hey, I'm going to do the Heimlich maneuver.